Well, welcome to our April Brainstorms event, and this one I'm really excited about. I know I say that a lot about them, but this one I really am, because one of my dear friends and a board member emeritus of Resurrecting Lives is with us today, Dr. Christopher Brown. April is and this may be a little controversial right now given the flavor in the country, but it is Minority Healthcare Month. And since we know that our military, because I've been preaching it for quite some time, is the most diverse population we have, we also know that this becomes very important because the complexities of being a veteran and trying to maneuver through the healthcare system can just be great. Once again, we are here in Sycamore Studios, beautiful Sycamore Studios in Plain City with our new technician, master technician, Ethan. And we're going to be jumping right in to talk to Dr. Brown. I've got to just say this. There are ivory tower physicians who teach a lot of other physicians how to do things right, and he could have been one of them. There are a lot of physicians who take on specialties that are really tough, but none are tougher than nephrology, studying the kidney that Dr. Brown did. And what I want to say is he's the only colleague of mine, the only physician I know who left the ivory tower where he could have been for the rest of his life and went to the rural areas to take his great time, talent, and treasure to the people in the rural communities. And so without further ado, I'm going to introduce you to my very good friend and let him talk a little bit about himself, Dr. Christopher Brown.
Oh, well,
thank you. Thank you for coming here. We're so glad you made it to Plain City. Thank you.
And thank you for the invitation. This is wonderful. It's an honor to be here and to discuss, minority health. Like I said, I think that it's okay to discuss it. It's part of America.
It has to be.
It's part of America.
It is. Right. It
So,
is.
so
And it's also a way we can save money down the road. So, go ahead with that. Dr. Brown, tell us a little bit. Tell us a little bit about your rural community and your veteran heritage. Seriously.
Okay. All right. So I'm originally from Lumberton, North Carolina. And I say Lumberton, but really it's the small towns outside of Lumberton. My dad is from a little town called Boardman. My mom is from a little town called Bladenboro. Bladenboro is small, but it does have one stoplight.
Okay.
Boardman does not have a stoplight. It has a stop sign. One side is uptown. The other side is downtown.
Okay.
That's all you got. Okay. So I grew up in these areas, and so that was kind of the way life began for me. So both my mother's side of the family, that grandmother was what we call a domestic worker. So she, we say worked for the quote unquote white people. My grandfather on that side was retired from military. He actually served in World War II.
Okay.
So we got some military on that side. And then on my dad's side of the family was very agrarian. So we had a large farm. So, we raised, pigs, chickens, things of that nature. They also did, farming for cash. So like a lot of tobacco farming.
Oh,
so we did a lot of
okay.
tobacco farming there. And so, and then we also would do different things. So like I said, we actually pick cucumbers. You can actually get paid to pick cucumbers. Oh, wow. So a lot of that work was what we did on that side of the family. Okay. That side of the family is also has a significant amount of military individuals. So my dad has two brothers.
Okay.
Both of them served. One has passed away, but like I said, both of them served. My brother was Air Force. He's retired. I have several cousins that have been in. So we covered the Marines, Air Force, Army, as well as the Navy. So we've had I think everything except the Coast Guard.
Okay. All right.
So we had a little bit of that. For myself, my daughter is actually in Air Force.
Yes.
So like I said, that legacy continues. So quite a bit of both military service to the country, as well as rural. So like I said, I have a little bit of both of those in the family.
And it shows with what you kind of chose to do. So when you were actually the person who taught me a lot about minority health and about the very many complications that you have just trying to get healthcare to them, we'll talk about in a couple minutes here. But in the meantime, how did you feel about coming to the big city? You got a couple degrees. You got a couple degrees to kind of get you set for a more or less academic career in medicine. So talk to our listeners. We want to know about your degrees, particularly that little mysterious MPH, because that makes you an expert in this field of delivery of healthcare in rural areas. So tell us just a little bit about that.
Okay. So I guess I guess that is a good point. I should introduce my academic background, as they say, my pedigree.
Yeah, that's good. That's a good.
So born and raised in North Carolina, and went to actually North Carolina A&T State University, which is what we call one of the HBCUs.
Okay.
And from there, I matriculated with a biology education degree. I actually was on route to become a physician. I'm a teacher, a public school teacher. And from there, actually went into medical school, University of North Carolina at Chapel Hill.
Okay.
And that's where I got the medical degree, as well as a master's in public health. And the master's in public health was in healthcare and prevention. While I was there getting the medical degree, they actually started the combined degree programs.
Oh, that's difficult, though, to get 2 degrees at one time. That's what you were in? Okay, tell me a little bit more.
So they gave you the opportunity to take a year off, either between the second and third year or between the third and fourth year.
Okay.
And what you could do is during that year, they would give you, the academic structure to be able to get a master's in public health. And you just had to pick one of the concentrations there. And yeah, it's a break from your med school career or matriculation. However, it gives you a different angle. It gives you a little different view of medicine in general. And so mine I chose was healthcare and prevention. And so one of the things that, we did that I feel like UNC Chapel Hill did was it sent us out into the different areas. So we actually got what I call farmed out to the rural areas in order to get a rural experience.
Okay.
And so you're coming from this top tier academic center.
Exactly, right.
And you're going out to these small hospitals. And so, we had that. We had a free clinic. So I was able to not only experience the rural area, but also to experience, kind of free clinics on those individuals that don't have, good health care. And so that became part of my passion was to kind of, give back. And so, it gives you a front-hand view of how to do that. With healthcare and prevention, or the Master's in Public Health, it teaches you how to view this and how to address, the various issues that affect people on a population basis.
I got you.
Even though you're treating them on an individual basis, but you have a view, a population view of this.
Gotcha.
So it's a little bit different than what most physicians will get.
It's a broader view for sure, a broader view. And so when we're talking about the military, for instance, being the most diverse population that we have, and I kind of rounded up some numbers and down some numbers just to make it really easy to discuss here, only a couple percentage points, but we're talking in the military about 50% of our military is white, 20% identify as Black. Then we've got about 17% as Hispanic or Latino. And then we have that last group that is, although it's small in numbers, it's huge percentages of the populations who serve. So, when we talk about the Native Hawaiians and the Native Alaskans and, the people Asian Pacific, we're talking about a small population. But in our American Indian cultures, in our Native American cultures, about 80% serve, male and female together. For instance, the Navajo Nation, we've discussed this before, 86% serve in the military, and 80% of those are in the Marines. I mean, we're talking about a small group of people who really give back to our nation and then go back on the reservation, and their health care is, almost non-existent in some of the issues that they have. And I'm just bringing that up because I know that you'll talk about some of them, as we go forward. I also wanted to point out that you kind of prove the research that they've done saying that being a person of service, being a person who serves in the military, right now, all volunteer military is only 1% of our population, it's genetic. There's a certain gene within it that is a service gene. You get more pleasure out of helping other people than seeing other people suffer. And so we're talking about you. I'm bringing this all back to the fact that you were what? You're 20 years old. You grew up on a farm. You're now in the big city in one of the major academic programs in the United States in medicine. Everybody loves Chapel Hill, North Carolina. And yet you choose, I'm going to take a year off. I want to see how to do things up here. What did that do on the day you graduated? What did you kind of have in your mind? Because you chose renal disease, and we know that renal disease is something that all of the untreated.
It affects it was one of those diseases that it kind of affects everyone,
Yeah.
but it is particularly aggressive in certain populations, African Americans, as well as African Americans, as well as like a lot of other minorities.
Gotcha.
And so it was a way to have a skill set that could benefit everyone, but in particular benefited this certain group.
Yeah.
And so that was a lot of what caused me to choose nephrology.
I gotcha.
Was because of this kind of dual role. And I guess, kind of when you say, how the Native Americans served the country, it's kind of the same thing. Like I said, I'm serving, everyone, but I am particularly serving this group of people. So it's that way of giving back. So that was what went through my head when I was thinking about doing nephrology. And now as you're talking through it, I'm like, yeah, that does kind of fit.
Yeah.
So it's kind of a service mentality. And the same thing with the Master of Public Health. I mean, the Master of Public Health, like I said, ultimately it's really kind of a service.
It's very much right.
It really is.
And we learned about that during the pandemic. I mean, it was Masters of Public Health that were getting out there saying what to do in the communities and that. Yeah, for sure.
Exactly. And speaking of the pandemic, speaking, I was able to utilize my Masters of Public Health, because I signed up to be a health commissioner in Ross County, and
a very rural part of
Ohio.
Yes.
Because I'd been out practicing for a while, I wanted to use my Master of Public Health, and the health department had a position as a health commissioner / medical director, and this was in 2019.
Yeah.
I think I signed the contract about October.
Okay.
I said it should be fine because I'm a full-time nephrologist.
Yes.
And hey, I want to use this for my MPH. Is it going to impact? They said, no problem.
Little did you know.
Little did I know.
Yeah, because we were going back and forth with my veteran population, and you were with our foundation at that time, actually on the board. We were going back and forth. I was getting intel from you that we could put on our website and that we could, kind of notify some of the people in the more rural areas, because as we found out then, 47% of our military members now are from those rural areas where it's very difficult to get health care. What are some of the difficulties because is that not the population you're serving now? I mean,
correct. So right now I am still serving down in Ross County. I'm still practicing medicine down there. But I split my time between there, and I actually have a practice actually in Westerville. Okay. That literally focuses on high blood pressure and early stage kidney disease.
Oh, wow.
And that was to kind of get again that giving back a little bit. I was noticing that these hypertension and kidney disease was not being managed appropriately in the urban areas. So I wanted to be a little bit closer there, but I didn't want to lose that touch.
Right.
So I was able to do both of those things.
Right. And when you say about, noticing it from a different perspective, I mean, we talked about this before we got involved in veterans, we talked about it years ago in athletes, because we noticed a similar experience there. Tell me a little bit about that. The young African-American athlete has a lot more issues that they can run into earlier on.
So African-American athletes, especially the ones that are coming from, like I said, this urban environment, tend to have, these chronic diseases that affect them a lot more than others. So one of the things that I did when I was in Columbus, there was a African-American male wellness walk. And it was actually started by a guy, Mr. John Gregory. Okay. And I actually participated. And when he would tell why he started this, he was doing he had a company that helped to build job skills in the African Americans. And I guess they were just talking, and they wound up doing just random screening, like blood pressure.
Yes.
And I think he said out of if I remember correctly, it was almost 30 young people between the ages of, if I recall correctly, between the ages of 18 and 25. And I think he said about 80% of them had high blood pressure. And a couple
Which
of them
is unbelievable. I mean, folks, that you're looking for it in middle age, more or less. And you're looking for it when somebody gains more weight, when they become diabetic because they've gained more weight. Right. But that was the thing that I thought was amazing. And I don't know whether that's done in our military or not. I'm not aware that there's a program specifically built to that. But when you're talking about, and not to get too technical here, but when you're talking about how much marching, how much laying down on the ground, you're talking about decomposing muscle and what that does to the kidney. So tell me a little bit.
Right. So I think that one thing, like I said, I think that one thing that'd be interesting to look into is the screening. Because a lot of times what happens for the civilian population, especially this grad, is that there's no one to screen them. Like, outside of this.
Yeah, that's true.
Outside of this, maybe you got a sports physical just enough to get inside.
Yeah.
A lot of times, they'll say, oh, your blood pressure is a little elevated, get it checked out later on. But there's no follow-up.
Yeah.
And so, once you graduate high school, if you don't make it out to college and you just get some sort of job, a lot of times that diagnosis is not evaluated any further.
I gotcha.
And so, like I said, now you got a combination of, a lot of stressors. Like I said, maybe your job is not stable. Maybe you got a new family. Like I said, then again, they also have other issues, interactions with law enforcement, stuff of that nature. So it's a high stress environment. And so, you wind up having high blood pressure that's at a level that ordinarily, like I said, sometimes we screen people and we actually send them straight to the hospital. I've had people that were in their 20s that have strokes strictly from high blood pressure. And so for the military, I would think that they would at least get this screened, evaluated, and treated. But the problem becomes when you serve your time and it's time to leave, there's a disconnect between that and connecting with the VA.
Absolutely.
And so people get lost in that space.
I think what they say now, there are fewer than 30% of our young veterans even utilize the VA for healthcare at all. Exactly. And when you talk about high blood pressure and those kind of issues, Dr. Brown, you're talking about, young men and women coming back with brain injuries to begin with.
Exactly.
So they've got vascular issues perhaps from the brain injury. They've definitely got the cognitive issues and everything else. That's a stressor. So you come home and people don't recognize you and you don't recognize home. I know one young gentleman that I talked to you about years ago who was from Portsmouth, Ohio, who was coming up to the VA for his first VA appointment ever. He'd been out for 5 years. He had, I think it was 12 traumatic brain injuries that I counted, incident answer. And he said, I said, are you working? He goes, no, I'm not. I can't find my way. And I said, pardon me? And he says, I can't find my way from my house to work on a consistent basis. And so they fired me. And I said, how far away was it? 5 miles. So he got lost coming up to his appointment for the VA and didn't make it the first time. Appointment canceled. Appointment was remade 5 months later. We've got to do a better job than that, I think, particularly with that disconnect and with, to also increase the awareness among all of our minority populations that these are things that we have to be looking at, because I didn't notice until I started learning from you, quite frankly, and during the pandemic, how much a higher income really does improve your entire healthcare thing. Because you talked about it, and I'm going to let you talk about it because you're the expert, but the diet, the ability to get prescriptions. What sort of things does somebody in a higher economic, for instance, let's say, urban setting have over even the same person in the rural area, and then if you have low resources on top of that?
So I think that I think it is a complicated issue.
Yeah.
However, I think just in general, income gives you a lot of flexibility.
True.
Income, like I said, if I have high income and say that I'm on the way to whether it's the VA, my regular doctor, or things of nature, number one, transportation.
Oh, transportation's huge, isn't it?
It's huge. And so if I have a higher income and I get up in the morning, my tire's flat, I call AAA, I go get this taken care of, no problem. But if I'm already living check to check, this flat tire is now a major issue. It's a major stressor. And then if you add, a TBI on top of that, now, like I said, this has become a major issue. And so income really helps with a lot of these sort of issues. whether it's transportation, it can be, how you present to whether it's, your healthcare setting, VA or civilian.
Right.
Like I said, people treat you differently based off how you dress.
Yeah.
So if I got more income, I probably got cleaner clothes, maybe better looking clothes. If I'm lower income, I may be presenting with a different presentation clothing wise, and people will treat me differently.
Yeah. And there's studies that have shown that. Because again, we're in this, kind of point in our society where we need to be reminded that does exist.
That does exist. So it's like, it exists. And like I said, when you add elements of, race to that, like I said, so it happens with even if you're white, it's going to happen.
Right, exactly.
But when you add the element of race, it goes on a totally different level.
Right.
And so you have those things going on. I think for the rural individuals, there's different things there as well. I think that yet again, income universally helps you no matter where you are. But one thing that I at least I think I see is that if you're in a rural area, because like I said, we grew up in a rural area, we didn't have like a lot of money, but we had land. And if you have land and you have work ethic, like I said, we grew our own food, like I said, we grew our own food, there's plenty, your life was exercise.
That's what I was going to say. So you've got, you're exercising, you've got good nutrition. Those are two places that inner city you do not have.
And over time, I've come to realize how different this was.
Yeah.
And I will never forget a friend of mine was, we were in a group of people. He was talking, and one of the things he was like, hey, have you all ever had a sugar sandwich?
A sugar sandwich?
Sugar sandwich.
Oh my God, it sounds great.
It sounds great, right? It sounds great. Right. But yeah, we didn't have sugar. We put syrup on bread and stuff of nature. He's like, no. It's a sugar sandwich because you don't have anything else in the house to eat. And I
feel so bad.
It's a whole different feel because like I've never, we're in, like I said, rural areas. We got, first of all, we eat the squirrels if you need. But like there's always food. Yeah. There's always protein. There's always food.
Right.
There's, I don't know what it's like to not have food in my house.
Right.
Even though, like I said, I come to realize that, like I said, based off of salary, like my dad never made more than $10 an hour, ever. Like I said, ever in his life. But we never went hungry the whole 9 yards. But like I said, listening to him talking telling these stories, like I said, there's nothing else in the house to eat. So got a little
whole
bit of
new
bread
perspective.
sugar.
I apologize to that guy. I feel so terrible because truly I thought that was going to be a good thing.
Yeah, exactly. That's what I thought at first. And and this nutritional angle becomes huge because you don't have the fresh fruits and vegetables. You don't have the high fiber foods. It's all low fiber foods. You may be getting your meals or your foods from a corner store, and there's no fresh vegetables and stuff that nature there. So in terms of food quality, just thinking about there are stories regarding different qualities of food in different grocery stores, depending upon whether or not it's a lower income or higher income neighborhood. And I've lived in a lower income neighborhood that actually had food that was not at good quality. So stuff that I had to put, pick it up, you look at it and you're like, this is not good, and I had to put it back. And yet again, this you kind of compare this to if I'm a lower income person in a farming community where, my dinner literally runs across the yard and I go get it and process it. It's that fresh. And so, there are those discrepancies that are there. And as we find out more and more about, the impact of lifestyle on our health, like I said, the access to fresh food, the access to fresh vegetables, and what that does to our health overall. I think that it's becoming of more importance as we go forward.
I think so too. And I've got to tell you something that just really bothers me. Okay. Right. And I will tell you, it's how many signs you see, like for veteran food kitchen or donate to veterans here. Like we're bringing in a couple cans of something and that's going to solve everything. So my question to you, Dr. Brown, with your MPH and all that, why is it that right now our young veterans, 1% of our population are serving, 1%, they're the ones who are providing us all with the opportunity to grow the food, to process the food. Why is it that we have so many of them who have such horrible nutrition. Isn't that on us? I mean, isn't that on our system of not granting a future to the people who guaranteed ours?
So I think that you're right from that perspective, but I think some of this is probably generational.
Okay, so tell
You
me,
know, if
yeah.
you think about it, I mean, 2 generations ago, the majority of people, at least, if at the very least, knew where their food came from. But as you talk about the generations now, I mean, like I said, there are people that don't know that their chicken nugget came from that chicken that runs across the yard. There are individuals that don't know where their hamburger comes from.
Yeah,
So
yeah.
there's that discrepancy there. So when you combine that with a military veteran
Right.
who's, like I said, maybe they left at 18, they signed up, and maybe they went on a tour or something of that nature. But remember, a lot of those meals are prepared for them, and so
Yeah.
now you're separating. Maybe you have a TBI, and your concern is not that nutrition. You're still looking for the meals that have been prepared for you.
Oh,
You know, you,
yeah.
you don't
Yeah.
have, you may not have those skills,
Yeah.
those food preparation skills. So now we've got to add that to a list of other issues that are going on. So you're just at the mercy of your environment. So if you have an environment that maybe it's got a Whole Foods that maybe you can afford, then you can get that whole food. Or even if you're going to a particular kitchen, you have issues. Okay, I know not to eat this. I know to eat this. But if none of that is there, if none of that infrastructure is there, none of the education is there, especially on the separation piece.
Yeah.
So it's like if I know there's an individual who, yet again, that person has maybe a couple of chronic diseases, and you add to that the TBI.
Yes.
So I know that this person may not navigate life as easy as someone that, it's a challenge for, especially for guys that don't have TBIs. Much less you add this on top of that. Now this individual's kind of navigating, trying to find the resources that they need.
Yeah.
If they know, even if they even know that they need that type of
No,
stuff. So,
isn't that true?
yeah.
That is really true. I was thinking, one of our board members, Paul Carlson, who's
Okay.
been on our board, first as treasurer, now as secretary, is really big on veterans growing their own food,
Yeah.
getting them into sustainable farming. Again, what he says is, the mission is save the world. I mean, let's get serious here. I've never seen a group, and I've talked to thousands of them, as you know, I mean, who not only wants to give back to the United States, but to the entire world.
Mhm.
I
Okay.
mean, I think that would be an interesting way, as he did, and I know you guys talked about it at the board meetings, to both educate them in it and get them involved in it. And we had Don Tobel, who was here just about a year ago, talking about how he does all the hydroponics. I think that there is a place for that, and you could, I think, foresee how we could tie that into the healthcare system as well. At least we would get both the nutrition and the exercise part, right?
That's a good point, actually. And now that you mentioned Paul, I haven't seen Paul,
Yeah.
but like now that you mentioned that, that could work. And the reason I say that is
Yeah.
I recently got certified in the American College of Lifestyle Medicine,
I'm
and that's
sorry, pardon me?
the American College of Lifestyle Medicine.
Okay.
So that's a relatively new certification
Okay.
that literally its focus is on managing and treating chronic disease through lifestyle changes. They
Wow.
really want to
Wow. That's very
minimize
interesting.
medications.
Okay.
And so they have and they actually have a ton of literature out there
Okay.
regarding, like I said, whole food, plant-based diets and its impact on chronic disease. They actually have a method where you can actually reverse pre-diabetes, lower high blood pressure, based off of simply, like I said, eating better,
Yeah,
exercising, getting good sleep, lower your stressors. And so as you're talking, I'm putting that together with that that's this ACLM and my public health, because one of the things you're seeing now is an increase in urban, what we call urban gardens.
Yes, right,
So
right.
yeah, so where these individuals kind of find plots of land, they grow this.
Yeah.
And like I said, I think there are, like I said, you do have the hydroponics as well. And I know a young lady that actually does this, and one of the things she notes is that it's sometimes difficult to get volunteers.
Right.
My dad has done it even in his area, and
Okay.
where he, like I say, he'll get something started, but then getting the volunteers.
Yeah.
But as you're mentioning this would be an excellent opportunity for veterans.
I think so too. Right. I
Because
think
they
that Paul
would
has
love
something there.
they would love this sort of, because it's very relaxing.
Right.
It's very relaxing, and you got, almost an immediate reward. Is giving back to an entire community. You can teach young people, older people, anybody,
Right,
and make
right.
this a community giving session.
Right.
That where you will see your reward later on.
Yeah, I think
So,
that would be very cool.
so.
One of the things that you and I had talked about, and you've come up with some very unique ways, I must say, about how you can identify people in these pre-conditions or early stage conditions when you can actually do something about it. And I'd like you to mention a couple of them. The one that I really loved in the rural area that I couldn't see any veteran wanting to go to was the barbershop medicine. And I'm using the wrong term here.
Okay.
But if you could just say, because I find that as something that may be transferable down the road to other veterans groups, but tell us just a little bit about, because that was very unique to me.
Yeah. So I was reading somewhere where they were talking about, and actually I know of a barber actually in Columbus that does this, and that is, the barbershop is for, especially, well, I guess for African American and for
Everybody,
for pretty much for men. There we go.
Yeah.
For men, it's kind of one of these cultural places where everybody comes. They talk about different things, and so what this individual was doing was actually bringing in health clinicians to talk and actually check blood pressure while they're there.
That's amazing.
And it's a huge cultural place because you bring in the topic, people discuss it, and when they discuss it, number one, for men, what happens is that men realize they're not alone. So if you say, "Hey, I got high blood pressure," he'll be like, "Oh yeah, I got it too. I ain't want to tell nobody."
Yeah.
And so you see it with that. You can bring in other conditions as well. Prostate cancer is a big one, and colon cancer screening is a big one.
Yeah.
Because these are
That's
conditions.
amazing. Yeah.
So these are conditions that men, for the most part, will they don't want to discuss it. They have issues. They have barriers to it.
Yeah.
But when somebody says, "Hey, I got prostate cancer and I'm getting it taken care of," or even for colon cancer, "Hey, I got that colonoscopy." What you mean? You got that colonoscopy? Yeah, I got the colonoscopy. It was not a problem. It's not like I said, just go there, get your prep, and take care of things, and then understanding and then linking that to kind of longevity, because a lot of people don't understand. Like I said, if you don't get, especially. The one thing I'm working on now is the colon cancer piece. If you don't get that colon cancer screening, 5 years, 7 years down the line, you can have colon cancer.
Yeah.
You don't want a bag.
Yeah.
Go in there and get this prep, get this taken care of, get them polyps taken out of there. And like I said, this is the way that you take care of yourself, take care of your family as well, and kind of linking those things together. And so that can be done easier in a barbershop setting where, like I said, hey, the guys are already talking, non-threatening. We just kind of sitting back, chopping it up anyway. So that can be done in those settings a lot better, and it's better received. So,
I've seen a similar thing just recently of a manicure and nails thing for women and women's health. And I do think if we could come, we spend our life waiting for people to come to us. That's how the whole system was set up back when I was young, which was, literally looking at the speed of things right now in the world. Like that was like, the Jurassic era, of medicine. We were waiting, but we really do need to come to them because, like we said, I mean, not only can some of our veterans with traumatic brain injury not find their way, but they don't have money for gasoline. They don't own a car. I mean, it really, I've heard the story. Well, the VA van will come down and say, the VA van may or may not come down. Yes, they do come down, but a lot of times there's that, what would you say, difference between having the older veterans on the same van as the younger veterans, because you guys with that, who's better, what war was better, that sort of thing. But I do think that this is why we want the civilian world to be more aware that these are issues. And the biggest thing being that we're going to be discussing in our book that's coming out, our Forbes book that's coming out, it's going to be called Guarding the Guardians. Giving gold standard care in healthcare, education, and employment to our veterans, because I'm tired of the word veterans. Because everybody, I love veterans. Oh, I support veterans. What do you do?
Thank you.
Well, I clap. Okay, and that is wonderful because you're not spitting on them like in Vietnam, and you're not, calling them names and that. Okay, but that's only talk.
far.
Yeah,
Right.
we need to do more. We need to get the civilian world to realize that they have issues. And since we do have laws where our veterans can come to civilian medical places when VA is not available, it's not available in many of the rural areas, we need to start spreading that word, right? And Christopher, you brought up something very interesting to me because I hadn't even thought of it, okay? Because I've always lived I grew up in a small town that was a suburban town of a big city. You know what I mean? That kind of thing. You were talking the other day, Dr. Brown, about how it's really hard to even get telehealth out if people don't have the infrastructure, the cable infrastructure for telemedicine. Is that correct too?
That is correct. That is correct. Because that's actually one of the things I discovered whenever during COVID, and we would have for the health department we would have these conversations, and of course, the other cities were shutting down schools and things of this nature, and and the kids were doing studying online, and like I said, the same thing with a lot of the clinics. They were doing they were starting to transition to telemedicine, and someone mentioned that, like I said, there were areas that were in our service. Like, no, they can't get the Wi-Fi. They don't have the Wi-Fi. They don't have that, like I said, that infrastructure there. And even as we were switching over to telemedicine, I mean, you would be talking, and like I said, maybe it could carry the voice part, but it couldn't carry the video, at least not consistently. And so, so like I said, when you talk about rural areas, you do have the issue of broadband access, which is a very real component. So yeah, I think that has to be addressed. Like I said, of course, you're always hearing this in the kind of the political world, but like I said, we'll see if it actually pans out.
Right.
But it's huge. It's huge. Because like I said, that is a method for getting information and support to the most vulnerable people out there. So
I know that was a big issue. I read some. My brother was in the public health service for a short period of time, but his assignment was in Shiprock, New Mexico, which sits on the Navajo Nation, which is when I visited him once, and I became very interested in the fact that there was virtually zero to minimal health care. I mean, we're talking about a group of people that COVID decimated the Navajo Nation during that, because people live far apart. There aren't great there's no teaching hospitals sitting right on a plantation. On a reservation, nor on a plantation. Come to think of it, they're not there. They're in the big city areas, and that was one of the things they said. They couldn't even get the words out because of the lack of infrastructure. So, I think that at a time when our nation seems to be going away from talking about these issues, that this is a perfect time to talk about them and say, we're not looking for handouts here. We're looking for simple education. We're looking for opportunities for people to be healthy. And as you said, if you take care of mild kidney disease, you're not spending the millions that you're going to spend for what is the course of that? This, and then dialysis, and then renal transplants, and then medications for everything. And the medications are not cheap.
No, they're not. So you're exactly correct. I mean, I think that, even as we kind of go into this space of, not mentioning it, we still got to mention it.
Yeah, exactly.
So the problem is this, and like I said, even if you go to, okay, we're America first, is that and the other. Well, I mean, what is America? America is citizens.
Yes.
And so what do you want? You want healthy citizens. I mean, like I said, any country or nation or whatever you mentioned, they all have vested interest in having healthy citizens.
Yes.
Because honestly, even if you look at our history, I mean, like I said, what we had what were those community gardens that were encouraged by the government before. There used to be national standards for high schoolers
for exercise, and for height, weight,
height, weight, and stuff of that nature. So maybe if we're not doing the quote unquote minority health thing of that nature, but you switch it into American health,
right,
and just make sure that it is applied across the board, and that you consider.
Yes.
The obstacles that different areas may have.
Yes.
That may be the approach that one has to take, at least in this environment.
Mm-hmm.
Like I said, I think that it's happened before. It's been navigated before. And so I think that, we can take some lessons from the past,
Mm-hmm.
bring them to the present, and make sure we're applying them to everyone.
Right.
So, and that's, whether or not you're in that rural area or whether or not you're in in an urban area, like I said, I think some of this stuff can be translated into those various areas, applied to, everyone really, to make everyone a little bit healthier.
Yeah,
So,
and more aware. Yeah, I think so
aware,
for sure.
More aware.
Oh, I find that really fascinating. So if we were going to be talking to our audience here about things that they could do, you and I have discussed this just a bit, and I said, it would be wonderful if veteran service organizations could get into this, but it's almost going to take a very different turn than what they are right now. They became kind of areas where people would get together and not necessarily do healthy things. It would be great
Right.
if you had, these particular posts, kind of turned over to exercise or family friendly, or we have this nutrition class, and maybe they can partner with some of the major food chains or food suppliers to get that done and have people I think that would be something that's very helpful to do. But I think it's going to come down to the communities. Tell us just a little bit about that. How do the communities find the people who are at need, find the veterans who are at need, and what do they do about it?
Well, I think now one thing I have found, and this is as I do the work in the rural areas, there's probably someone working on it. The barrier is to find that person,
okay,
and give them the resources that they need. There's
very
almost
interesting.
a lot of them. They know the individuals that are having trouble, that are having struggles. A lot of times they'll have ideas, but it becomes difficult to get to give that idea the resources that it needs.
I got you.
So making that sort of connection there.
That's a great
and I
idea.
think that I think that's probably one of the big things to do. And some of this may be like I said, that those of us that maybe like I said, especially those of us that maybe came from those areas, maybe who came up to the big city or whatever, sometimes reaching back.
Yeah.
And like I said, and sometimes you have to be proactive. So even for my hometown, I'm finding myself having to be proactive about calling and setting up meetings and saying, hey, what do you all need? How can I help? Because a lot of, I think, and this is in these conversations, that a lot of times once you leave, and especially if you've been gone for a while, people not only kind of forget. I want to say they don't forget. They remember you as you were.
I see. Yeah.
They remember you as you were. They don't remember. They don't know what you've done and things of this nature. Yes, you may have been in the paper in Columbus or Cleveland or wherever you are, but they don't have that paper. They don't know. They don't know that like I said, or they may even not understand. What's an assistant professor at Ohio State. What does that mean?
Right.
What do you have access to? And so reaching back, finding out what issues they see,
Mm-hmm.
and then trying to, deliver resources to address those issues.
Oh, that's
and
really
so,
brilliant.
like I said, because that's one of the things I'm starting to do now. Because I've done a thing where you kind of donate money to people,
Yeah,
kind of like donate money to people and support these little issues. But I think that
doing it. Yes,
you got
I
to
agree.
roll them sleeves up. Go down there and say, hey, we got this going on. And then they could tell you who, like I said, okay, this person's having these challenges. Hey, we got some veterans over there that need some things, but they can't quite navigate through. Or maybe they can't get to the VA. Okay, well, tell them Dr. Brown said.
Yeah, right. No.
And understanding the power of that, like I said, maybe a memo to somebody. Like I said, we'll have, like I said, those of us that have, those of us who've been given a lot have to give back a lot.
Exactly.
So, and sometimes I think that we think that people should approach us, and kind of like you said, I think we have to start.
I
reaching
think so too.
out,
Exactly.
So to reaching people. So.
Well, gosh, we've really enjoyed having you here. This year, I'm asking every one of our guests to kind of end with the quote, something that kind of defines them or defines what they do. And I would like you to do the same, if you don't mind tonight.
Okay. So I think I would use the quote that my granddad, who was a veteran of World War II, always used, and that is, an ounce of prevention is worth a pound of cure. And like I said, as I matriculate, and especially now that I have this credential in lifestyle medicine, that is the big, that's the big push right now. And that is, we want to prevent things. That's why I focus on early stage kidney disease and not late stage kidney disease. That ounce of prevention is worth a pound of cure. You can do a little bit of a change here in the beginning, and you can prevent late stage kidney disease, dialysis, transplantation, increased medications. So an ounce of prevention is worth a pound of cure. So that's what I would say.
I love that. And that is really true. And that's true even for our government in terms of, dollars and cents down the road. So
exactly.
for sure. Wow. Well, I want to thank everybody for being with us. I really have to thank my good friend and colleague, Dr. Christopher Brown. This is a very interesting topic. It's a controversial topic. It's been a controversial topic my whole life, really. So what I'm asking of our audience, if you have some questions about it or you have something specific that you'd like to, please feel free to contact us at the info@resurrectinglives.org. We will try to get to your questions within a couple days and see what we could do within your communities. But the thing is, everybody kind of keep aware we are the United States of America. Okay. Our military represents all of us, and they are the only ones who are keeping us going. And in fact, pretty much keeping the world going right now. So let's think of ways that we can particularly take care of them in our communities and make sure that they get the kind of reception coming back, which is, man, we're happy to see you back. What can you teach us? And here's what we can show you. Thank you all very much. We'll see you on the next Brainstorms.
If you are thinking about harming yourself or attempting suicide, tell someone who can help right away. Call 911 for emergency services. Go to the nearest hospital emergency room. Call or text 988 to connect with the 988 Suicide and Crisis Lifeline. This podcast is made possible thanks to a grant from the Overwatch Alliance, and it's produced by the Resurrecting Lives Foundation at the Sycamore Studio. Music is written, performed, and graciously provided by Tim Beckley. Remember, when you work toward brain injury recovery, it is best to journey with a friend and keep your gait steady and your spirit strong. Finally, always seek shelter from your storms.
From Baghdad to Basra, the Boston, the Bakersfield, the hottest battle I ever fought is raging inside of me. My brain has been battered, scrambled and rattled, and no one knows what's going on.